Welcome, everyone, and thank you so much for joining us. I am Jessica Collins, Executive Director of the Public Health Institute of Western Massachusetts. And thank you for joining us today for updates on COVID-19, what you need to know about the Delta variant, vaccinations, and masking indoors. We are recording this webinar. And we are grateful that all of you have joined us, though unfortunate that we are, as a nation and a region, in this place of continued uncertainty. Though there has been much loss, there have been unbelievable breakthroughs, unprecedented human effort to take care of each other. And I am very pleased to introduce our two distinguished panelists who are with us today. Dr. Armando Paez is the chief of the Division of Infectious Disease at Baystate Health, where he leads the Infectious Disease Fellowship Program, is an assistant professor at the University of Massachusetts Medical School, a member of the Vaccine Safety and Efficacy Task Force for Massachusetts, and serves as a board member of the Massachusetts Infectious Disease Society. We are also joined by Ms. Doris Harris, who has received her college education from the University of Massachusetts and Smith College. She is a radio personality and host of the Health Matters radio talk show, WDTTC-FM, and the health editor for the Point of View community newspaper. She was appointed the co-chair for the Springfield Black COVID Coalition, as well as serves on the Springfield YMCA Advisory Board and the Massachusetts Department of Mental Health Board for the Western Mass area. Ms. Harris has also been a consultant with the Public Health Institute over the past year for COVID-19 education and outreach. Thank you both for joining us. And Dr. Paez will share first, and then Ms. Harris, and then we'll have a question and answer for the last 15 minutes. Thank you for sharing your questions, all of you. When you registered, we will have all of them answered as best we can on our website following the webinar if they are not answered today. So Dr. Paez, thank you so much for joining us.
Thank you very much for having me. Thank you for that nice introduction, Jessica. So let me just go ahead and share my screen so that we can start moving on. Let me just see. Where is my screen? Sorry.
It's okay. Take your time.
Yeah. It has screen. See here. Can anyone see my screen or no?
Not yet.
Oh, goodness. It's just not behaving well. Hang on for a second.
There you go. All set. Just need to change it to your PowerPoint.
Yeah, let me just see. There you go. Did it work?
Yes, it did. You're all
Okay. Thank you very much. I'm sorry about that. I should be an expert in this. It's like more than a year and a half now of Zooming. So again, good afternoon, and thank you very much for having me. I hope in the next 20 minutes, I'm gonna review where we are in the pandemic. And then I'll talk to you about what we learned as a community from this experience. And then I'll discuss the roles of the variants and the vaccines in the pandemic experience. And then I will be revisiting infection control measures as we deal with the Delta variant. I just want to let everyone know that I do not have any financial interest to disclose. So where are we in the pandemic? As you can see from the slide, which I took from the mass.gov dashboard, we are in more than a year now, more than a year and a half now in the pandemic. And remember the first surge way back when we didn't know what's going on. We felt it was the end of the world, and yet it was not the end of the world. It felt so stressful, and many people died at that time. We thought after that first surge that it's somewhat we're going to be fine, and then lo and behold, we had another surge, which happened last winter. And if you look at the graph, the surge is even greater than the first surge. At that time, I remember addressing this and working on this, treating patients. It felt like it was more familiar, and yet there was a lot more cases at that time. And there was a small bump at the end of the winter time, and then there's a lull moment, and we had this fun summer, very brief though, and then we have the surge now due to the Delta variant. And the current testing positivity rate is around 2.51. We're better than our friends over in the southern part of the United States, but it's still here, and because Delta variant is still roaming around in our communities. What is the level of COVID-19 cases locally? This is the Hamden County. The curves that you can see over here mimic the one that I showed you in the state, similar to what we have in Hamden County. But I'm showing this slide to alert you that most of the counties in the state is in the red region. The orange one is the substantial transmission. So we are actually at the substantial or high risk region of transmission of COVID-19 as we speak. And that this is actually related to some of the measures that the CDC and the state government are recommending in order to address this situation. And what did we learn from our own experience? What I can tell you is that we know more about COVID-19 now and learned how to treat it. Remember, we learned about this disease actually on the fly while it actually spread globally, not only in the United States, but all around the world. And at this point in time, we have learned how to treat it, but we still haven't really made a big breakthrough, unlike the vaccines, in terms of treating the mild to moderate infection, like an oral drug that's easy to use in order to prevent the progression of COVID-19 and preventing hospitalization and deaths, and for those patients who are at high risk of developing this. We do have the monoclonal antibody, which is now promising in preventing severe infection. However, it requires an infusion or an injection to those patients. On your left side is the graph of the infection due to SARS-CoV-2 that can cause COVID-19. Mainly, it is through the inhalational route. It binds to a receptor along the respiratory tract. And there's a period where there is a pre-symptomatic or asymptomatic phase where the virus multiplies, and you can see there is an increased number of virions. And approximately a median of 4 to 5 days, the patient will either remain asymptomatic or develop symptoms. Those patients who will have symptoms typically will have fever, headache, cough, and there are patients who end up having sepsis or increased or hyper-inflammatory response that lead them to really severe illness and admitted in the hospital. And what are the risk factors for severe infection? What we know now is that age is an independent risk factor for severe illness. The older you get, the higher chance of you having severe illness. However, there are specific conditions that are consistently reported to be associated with risk of severe infection, and that includes what I've listed here, including chronic kidney disease, chronic lung disease, obesity with a BMI of about 30, immunocompromised state, patients taking prednisone, for example, or other medications for transplant, or anybody who has serious heart conditions, diabetes. These conditions really predispose one to have a more severe course of infection. And the CDC 3 months ago expanded the list of those risk factors. The most common ones are heart disease, diabetes, and lung disease. Other things we learned is that in the past, we thought that it's not really airborne. It took some time before we admit that it was an airborne disease. It can be airborne. Most of the time, it is just a droplet, meaning to say it doesn't linger in the air for so long, but it does. And that's why it's very infectious. We know now that children and adolescents are still susceptible to SARS-CoV-2 and can transmit similar efficiency as adults. However, they have a lower rates of severe illness compared to adults, and that's why we don't see a lot of them in the hospital. But we do see some. We still don't understand who are at risk of those kids who end up in the hospital. We also know, or we learned, that those patients who recovered from COVID-19 will have some viral fragments detected in the testing, but it doesn't mean that they're infectious. Typically, after 10 days of recovering after the start of symptoms, most people will not be infectious. For those severe infection, up to 20 days. After that, they're not infectious at all based on the studies that have been conducted. Now, the respiratory dysfunction in COVID-19 is somewhat unique because it progresses rather quickly once patients develop some difficulty breathing. Critical illness is mostly due to the host immune response rather than the direct viral effects. And it's mostly the body reacting to this virus, which was previously was not known to human race until more than a year ago. And the things that we learned, and we tried some medications that we tried, the laboratory findings, they don't always translate to clinical efficacy. Like, for example, hydroxychloroquine, which we initially adopted to start using, and they end up having turned out to be not effective and could harm patients. What did we learn from experience? We have developed safe and effective COVID-19 vaccines in less than a year of the pandemic. I just want to remind everyone, we have given given patients 363 million doses in the United States alone. And serious safety problems are rare. Long-term side effects are unlikely. Typically, side effects of autoimmune problems or anything related to vaccines, they occur within 6 weeks. And now we have been vaccinating individuals since December. And if there's anything that's related to this, most of them we already know. Breakthrough infections, unfortunately, occur, but still rare. And we know that because of Delta. Vaccine immunity against circulating variant is waning, and hence you have heard about the booster shots that are recommended, particularly in immunocompromised individuals. And later on, it will be recommended starting September 20 for booster shots for everyone in a manner of that will be prioritized who are at most risk of severe infection and high risk of exposure. These 3 vaccines you've heard all the time: the Pfizer-BioNTech that is now approved, and we have Moderna and Janssen or Johnson & Johnson vaccine. Now, our vaccination rates in Hamden County, as you can see in the slide, we're lagging behind the other counties in the state of Massachusetts. This has improved in the last few weeks, but still has a lot of room of improvement. We are at 60% in this side of the state compared to other counties in Massachusetts. when I look down and which categories have lower rates of vaccination in Hamden counties, you can see people of color really have lower rates of vaccination. We're talking about 38 to 44%, compared to other race. And what we know, also what we learned, is that the virus mutates and adapts. And the Delta, which is a variant that you heard all the time, or hearing all the time, in the news, from the original strain of infectiousness of 2 to 3, or what we call the Delta or the R naught, which is the basic reproduction number or the marker for infectiousness, which equates to the expected number of cases generated per infected case. It rose from 2 to 3 to about 5 to 7. If you compare that to influenza, which is only the R naught or the infectiousness is about 1.3. So you can see that the Delta is very infectious. And what's also concerning is that it is associated with more severe disease. And then we experienced in this outbreak that led into some recommendations by CDC, in the Cape Cod outbreak, fully vaccinated people had breakthrough infections. And those patients or individuals who had infection in the Cape Cod outbreak, 74% of cases were vaccinated. And what they found in this cluster is that there are similar amounts of genetic material found in both unvaccinated and fully vaccinated. And what it means is that those patients or individuals can transmit this just like the unvaccinated folks. The good thing, though, is that it is a shorter duration of viral shedding, and that's the effect of the virus. So compared to the Delta, to the original strain, it's 2 times more infectious. Now, the variant Delta is the orange one. This is just a graphic representation that it's 98.8% now that it is circulating in the United States. And you can see this only happened like within a span of 6 weeks. That's how infectious this variant is. Now, somebody asked me how much protection does the or the vaccines offer now with the Delta variant. This was just released 4 days ago. This is a study in healthcare workers who have been vaccinated. Most of them are vaccinated by either Pfizer or Moderna, mostly Pfizer, 2% from Johnson & Johnson. So before the Delta, it was 91% effective in preventing infection. It went down to 66%. So the healthcare workers are the population that has a high risk of exposure. What else did we learn from this experience? So the Delta variant, we still need a multi-layer approach, in my opinion. In addition to vaccination, I think masking, physical distancing, and good hygiene really most likely will be needed to control the pandemic at this point. The unvaccinated, as per CDC guidelines, masking really is recommended all the time. For vaccinated folks, masking is required in certain situations, particularly if you're immunocompromised or if you're living someone who are immunocompromised, and if you are with someone who are not vaccinated, and that includes children. On the left side is a graphic representation of effectiveness of masking, the efficacy depending on what type of mask you use, and the adherence. As you go towards the blue color in the figure, the higher the efficiency in preventing infection. So your guide to mask, this is in CDC. As I mentioned, if you're not fully vaccinated, age 2 or older, you should always wear a mask. These are the guide for you, what mask to use. And at least a 2-layer washable, breathable fabric. You should cover your nose and mouth and should fit snugly. And usually a nose guard that prevents air from leaking out is preferred. Other considerations to improve ventilation, as this is a common question. It's not only masking, but also the the ventilation plays a role in the spread of this virus. Um, as much as possible, do your activities outdoor, because outdoor is better than indoors. That as I said, the virus can linger airborne. Use fans to increase effectiveness of open windows. Use a good ventilation system. Turn off any demand controlled ventilation from auto to an on position, so that the fan is continuously working. You improve your central air filtration. Obviously, in high risk situations, a HEPA filter is preferred, like in a clinic or in the hospital. And ultraviolet irradiation is a supplemental treatment for this. In non-residential settings, as I mentioned, a HVAC system is recommended before and after the building is occupied. Use that for 2 hours. So this is, I think, second to my last slide. Communities and organizations should really update the COVID-19 prevention strategies based on the following. So we should know and take a look at the community spread, where we are in on the spread of this infection, the health system capacity, are we able to take care of our sick patients, our vaccine coverage, how many in the population, the communities are vaccinated. We should be able to test and detect early COVID cases so we can treat them and isolate them so that it doesn't spread further. And we should also identify the populations at risk for those who are vulnerable. So looking down below on the slide, the high vaccination and low community spread, then there will be less need for masking and other prevention strategies. So my take in my experience, and I want to share this with you, is that as the virus evolves, we really also need to adapt and think ahead. And that is something I know it may be disappointing to some that, we thought that vaccine will kind of end it all, but unfortunately the virus adapts to it, and we have the Delta. And I think we have to respond to that, and we have to adapt to this. Because if we allow it to multiply and replicate, it will evolve to something that will be resistant to the vaccines that we have. And I don't think that is something that we want to experience, because it's going to be the same story all over again. And I think this is my last slide, and thank you very much.
Dr. Paez, thank you so much for that extremely helpful overview with all that updated information. We do have some questions, but I'm going to hold on those right now. And I would like to welcome Ms. Doris Harris to share on her reflections, as this is so much a clinical, obviously a clinical experience for us, but also such a human experience with regard to how we are responding in society. So Ms. Harris, could you please share your reflections?
Yes, well, thank you, Jessica. One of the things that I have noticed in my outreach efforts is it's important that you communicate. And how you communicate is that you engage individuals, you listen to them, and you be patient. What this pandemic has showed me that there are groups of people, especially people of color, who feel that they don't have power, that they don't have control, and that the government is trying to force something on them. So how I handle outreach is to allow them to have their own voice, to empower them and to motivate them so they will make the best decisions for themselves. I like to do outreach in settings where there is, for example, when I first started going out and doing outreach, there were soccer games, baseball games that kids had throughout the city of Springfield. And I noticed that at those particular settings, people were a lot more comfortable. They were more willing to talk, and they were able to relax in terms of by me providing information to them. I don't talk at them. I talk to them. And that is another key. I just want to share before I move on that I had a single mother who had two young children. And she said to me, this left a lasting effect on me, because she told me that she didn't have time to think about getting the COVID vaccine because she was working two jobs. She worked 6 to 2, and then she turned around and she worked 3 to 11. She was leaving her children with an elderly family member. But what I had to share with her is, who's taking care of you when you have to take care of everyone else? So it's important that you encourage people to do self-care as well as preventative care. In my findings, I found that a good percentage of the individuals that I was talking to didn't even understand or know what preventative care was. They only went to the doctor when they were sick, and a lot of times they didn't go to a primary care physician. They went to the ER. So they didn't have a good understanding of what exactly was preventative care. So how can you talk to an individual about getting a vaccine, which would help with preventative care and also help the community at large? So I had to listen to where there was a lack of trust and also why they didn't do it. And a lot of information that they received came from other community members and family and friends. And I'm going to call this urban legends because people would say certain things. The one that stands out is that you're going to have microchips on your body. And someone said to me that they heard that a woman was able to put a bottle cap on her arm and it stuck to her arm. Well, I said, well, where did you hear that from? Well, I heard it from this person and that person. So by the time they get that information, it becomes very misguided and very misleading. So what I like to do would come with some facts. I also share with them that I had a little bit of hesitancy about getting the vaccine, but I knew it was the best thing that I needed to do for myself and my family. So I moved forward with that. I also will let them know that if they're not considering the vaccine, one of the things that they need to do is harm reduction. They need to do the 3 R's. They need to wear their masks, they need to wash their hands, and they need to watch their social distance. For some reason in certain communities, that have gotten lost. People were told if you got your vaccine, you could take off your mask. Well, how do you mandate that? So everybody now is walking around without a mask. And I share with them, it's still important that you protect yourself so you're able to protect others. As I move through this process, I also would ask them, do you have a primary care provider? Well, I saw the doctor, whatever. Do you know that there's other types of health conditions and other type of health maintenance that you need to do? There's also different types of vaccines that you need to take throughout your life. Again, it's education. It's not talking at, it's talking to. It's empowering individuals so they can have a voice. The Delta variant has helped me move people along because now they realize this is not going away. So I was very happy. I met a couple of individuals at the pancake event that they had. And the Baystate Vax bus was there, and they were able to move forward. Again, there was also fear that something was going to happen. Individuals would say, well, I'm just waiting. Well, what are you waiting on? I think they were just concerned. There was some fear there. So you have to try to help with where does that underlying fear comes from. And again, we know there's a historical background with the lack of trust within the African American communities, as well as the Hispanic community, with health systems. We know that there were studies and tests done that were unfair to individuals. But as we move along, we still need to have people realize that they have a voice. You can see another doctor if you don't agree with the one. You can ask questions. Another message that I received was, where do I go to get the vaccine? There were clinics and there were health centers that had openings where people could come in to an open door system, but that didn't start off till late. Initially in the city of Springfield, everyone was told to get on a computer, make an appointment. There was probably a lack of understanding and consideration that some people didn't have access to that. So they pretty much pulled away and didn't know where to turn to. I'm very happy that there are different venues and different events that people are going out and getting their vaccine. However, there are some events and venues where people are going just for the event and don't necessarily feel comfortable going and getting their shot. I think it's a multi-complex issue. I think that every time you come to the doctor, someone needs to ask you if you got your shot, even if it's an emergency, and encourage and motivate. I do a show called Health Matters. And on that particular show, I had an individual who talked about her experience with getting a shot. And after that show, I had so many people who felt very happy. People want to hear from people who look like them and maybe sound like them. So I think it's important that we have representation of people going out to communities that they represent. Public Health Institute, when we go out, we have cards. And I just want to show one of the cards because I'm very proud of them. And on this card, it has a list of what you can do and who you can contact. Also, I ask people, would you like to have some additional support or information from me? And I can put their name down. More than likely, they're willing to give me their phone number and have a follow-up call. What motivates a lot of individuals in the African American community has been, can you do this for a family member? Can you do this because you have an elderly mother? Can you do this because you have grandchildren? The thought process doesn't go there. Sometimes it's just immediately, I'm afraid to do this. So you have to educate and let them know how this affects their family member. If you have a family member who has an underlying diagnosis of diabetes, you definitely want to get the shot because you're protecting them. So that's one of the things that I think is crucial, that there is emphasis on doing this as a whole for family members, for your church members, and also for your community at large. Thank you.
Oh, thank you so much, Ms. Doris. That was so interesting. I love how you can just free flow on all of these different conversations you've had for 6 months. It's
Thank you.
all right. Well, thank you both. And now we are going to pose some questions to you. Some were received when people registered and some that are being put in the chat. And so what I'd like to do, because I see this as repeated in the questions, is go back to Dr. Paez and ask you, could you talk a little bit more about expectations around boosters and people who are maybe coming in for their first vaccine? And what do you think will be a timeline for boosters? Could you talk to us about that, please?
Yeah, I think that's a very important question. That's a common question. So what is recommended now, and CDC already recommending an extra shot for immunocompromised patients. So we call that booster, but actually it's probably part of the primary series that they actually need. Because what we found is that after 2 shots for the immunocompromised individuals, meaning to say transplant patients that are moderately to severe immunocompromised individuals, the level of protection is so low. We're talking about like in the range of 30 to 40% compared to when it was first studied. Remember, the clinical trials conducted were otherwise healthy individuals. It was a 94%, and they excluded immunocompromised individuals. It took some time before the study came out with the immunocompromised individuals, and it turned out that it's very low. And so they recommended that there's now recommended that they're going to have the 3rd shot, and they call that still a booster shot, but most likely it's better term as a primary series of shots for immunocompromised individuals. Now, the booster shot that we're talking about that is recommended in the general population is also being recommended. We're thinking about September 20th. That is what the CDC is aiming for in terms of the vaccines that will be available. And what we found, and this is based on the Israel data, is that along with the Delta and the waning immunity, that there are breakthrough infections and the protection against the circulating SARS-CoV-2 and happen to be Delta. It seems like the 2-shot vaccine schedule doesn't protect enough, either because of the Delta being strong or the immunity that we received from the vaccines are waning because it's already been more than 6 months. And initially they thought it's going to be 8 months, and now they're even thinking about 6 months and even 5 months. So the official word is yet to be announced.
Okay.
So that's for the booster, yeah.
Yeah, so a couple of quick follow-ups. So basically, if you've never received a vaccine, the expectation is that you will get the original 2-shot dose, and then potentially later on you get a booster.
That is correct.
Already been vaccinated, potentially boosters will be available as early as September 20th.
That is correct. And
okay.
And that's the thing. We can't blame the scientists. We're learning on the fly here,
Yeah.
And it's so amazing. It's like in the last 6 months, we didn't know about Delta, right? I thought it's going to be over, but it's not really over, but I thought we're going to have a fun summer, but apparently not, the Delta really, changed the equation here.
So just 2 quick follow-ups on that, Dr. Paez. So first of all, if someone has had COVID-19, are they also expected to either get a booster or get vaccinated as soon as they can?
Okay, so there's a story behind this too, right? So those patients who got COVID-19, what we learned last year is that their risk of infection is very low, almost zero within 90 days after recovering from it, right? And then we didn't know how long the immunity from natural infection will last. And so CDC recommended, let's get them all vaccinated because we're going to take those chances. So as long as you recover from COVID, you are eligible, or you can get the vaccine in order to get extra protection. Now, like 3 months ago, we learned that if you actually get a vaccine, in addition to having a history of infection, you're actually get a lot more protection than if you're not going to get the vaccine. But having recovered from COVID-19, actually based on more recent data, again, this is not peer reviewed yet, your level of protection even lasts longer for more than a year. But again, there are variants.
Mhm.
We always need to ask protection from which variant, just like when the clinical trials were conducted more than 6 months ago, or more than a year ago, it was on the Alpha variant, right? It was a different, the South African variant. So, but now with the Delta, the equation has changed. So it's really, don't forget that part of the equation that we're dealing with a different variant this time.
Okay, so I think everyone, please stay tuned for more information that will be very, clear about recommending when people go get vaccines and boosters, as well as more information about how the vaccines both affect the Delta variant and other variants that are being talked about in the news right now. More information.
Yeah. And that's the thing. So a lot of people kind of feel sad, disappointed, frustrated, or angry. It's like, I thought vaccines are, not effective. Well, it is effective in preventing serious infection. Unfortunately, we're disappointed it's not as effective as we thought, that getting a mild infection and passing it on to another individual. Yes, we kind of failed in that way, but again, it is still beneficial. Now, if I run a hypothetical scenario that, how about if I say that the new variant, which we called it a different name, how about if it's resistant to the current vaccines? Probably now people say, I think I need to get that vaccine now so that we can prevent that from happening, because it can happen.
Yeah. Okay. I've got one more question on the vaccine, then I want to switch to children. So the last question is, when you are speaking about immune compromised people needing boosters, are you referring to everyone who is immune compromised or only specific conditions?
Only specific, it's basically moderately to severe immunocompromised status. And solid organ transplant, there's a list of patients or individuals defined by CDC.
Okay, great, thank you.
Yeah.
So I'd like to shift right now to talk about children and the children who are heading back to school, who are not eligible for vaccines. And you had in your slides about absolutely everyone should be masked around people who are not vaccinated. So I'd love to just get a little bit more clarity out there for the audience. If you've got children under 12 who are at school this week or going back to school, are you suggesting, Dr. Paez, that we should all be masking within our households for our children who are unvaccinated?
Sorry, I missed that first part. So you're asking now that with the school opening,
Yeah.
Are you
for younger children under 12?
Children. Yeah, that's correct. I mean, so the issue is that, if you're vaccinated and you can have an asymptomatic or mild infection, you can pass it on to the unvaccinated population, and that's include your children. So if you live in a household with children who are unvaccinated, or even adults who are not vaccinated, or individuals who are vaccinated but immunocompromised, I think you should mask in high-risk situations. What are those high-risk situations? We already know indoor public places, public transportation, even outdoor activities. If there's a lot of crowding, I really recommend to have masks. One thing too that we haven't experienced last year is the flu. We haven't had a flu outbreak. If you stop masking, that's another benefit that we may lose if we don't mask. And we can have a dual pandemic, or hopefully not, but with flu and and COVID, or even RSV, which is another respiratory virus, it's really going to be a bad winter if we allow that to happen.
Okay, so kind of picking on Ms. Doris's self-care and prevention, indoors with a lot of people, and even outdoors with a lot of people, we want to be very careful to be aware of our family members and community members that are not vaccinated. So masking up, washing your hands, social distancing is still the key messages. So Ms. Doris, I'd love to come back to you and a question about a particular age group that has been somewhat hard to reach with regard to healthcare always is of 20 to 35-year-olds who just, are very, typically healthy and invincible, so to speak. Do you have any thoughts, or have you heard anything specific from that particular group of people and how they're thinking about COVID-19 and prevention? And you are muted, just so you know.
I have heard from their parents, from their mothers. And one of the things is the lack of education, the lack of understanding. They're healthy, they feel good, they're on the basketball court, so they don't perceive themselves as being sick. So it's giving them information and letting them know that this is here. You have to protect yourself. They are a very tough group. But again, I like to encourage the parents to work with me so they can work with their child in order to do it. I have another story, and that was a mother who was on oxygen. Her son didn't know that by not being vaccinated, he put his mother at risk. So she needed some support and help from me that I could help him understand this. And that's what I did. And then he agreed because we said, you won't have your mother around. If you put yourself at risk, you're going out, you're among groups of individuals. And that's when he realized. So it's engaging. It's also to be patient, to talk to and not at, to allow them to have their own voice, to express their opinions on why they feel this is something they don't want to do, and then give them the necessary information for them to make the best education for themselves, the best decision for themselves. And when they can't make that decision, I always go back to harm reduction and why they should wash their hands. Maybe they should mask. But I do see a turn with some of the individuals that I have spoke to, and they said, no way. And now, because they see this as a continued pandemic, they're willing to maybe consider getting a vaccine.
That's a perfect lead-in, actually, to another question for Dr. Paez regarding these other variants. So questions are, well, first of all, the ICU beds in the regional healthcare institutions, people are curious about where do we stand right now with regard to our regional ICUs, and also, are we seeing cases for the South African or any other variants besides Delta in our region? Do you know?
Well, the first question is that at this point in time, we have capacity to treat seriously ill COVID-19 patients. And as you know, Baystate Health System, we have the Baystate Medical Center in the community hospitals. And we continue to work in order to make beds available in ICU for severe infection, from COVID-19. With regards to the variants, so as the slide that I shown, in the whole United States, 98.8% is really, that's due to the Delta variant. So it's a Delta variant that is circulating at this point in time. We did see in the past Beta and Gamma variants, and that's preceded the Delta, and that's like more than 6 months ago.
Okay, and so staying on that theme, I think there's still some clarification, perhaps, because we've got some time to talk about people who have weakened immune systems. We keep using this term. You've already said there are kind of very special conditions that are listed on the website. CDC, Baystate Health, I believe, has them listed as well. But with regard to just kind of general healthiness, should there be an emphasis with regard to prevention moving forward if this is going to be a long-term presence in our society? Is there a way that people could boost their immune systems as well as getting vaccinated and doing all this prevention work? Is there talk in the research about just basic, healthy practices?
Well, the short answer is no, apart from being healthy, and it depends on how you define it. What we know is that if you're deficient, for example, vitamin D compared to those with normal vitamin D, you are more at risk of having, at least in some studies, at risk of severe infection. And most of us living here in the Northeast, a lot of times we do have, decreased vitamin D levels. And that's something that, I think you should be aware of. There's some signals in there, but to get mega doses of vitamin D, I don't think there's data that it will protect you from getting infected, because primarily it's an infection. I mean, you can only get so much of healthy immune system, but remember, the body has not seen this virus. It will react to this. And the way the body reacts is what makes people sick, because the hyperimmune response is what the cytokine storm, we call that. That's the one that can get you the respiratory failure, the overwhelming immune response. And that's the reason why one of the medications we give is to tame it down a little bit at the tail end of the infection, because that's the one that actually makes people sick for the most part. It's very interesting. It's like the whole science of this kind of infection. So.
Okay, thank you for clarifying that. Here are just some basic questions, maybe slightly redundant, but question about the masks. So could you speak to, is there one mask that we have found to be more effective than other masks? And then I also would love for you to speak to testing and how are we handling and encouraging people when to get tested?
Yeah. So about masking, so there's also a question about N95, because I think there's one question that was, the one that you forwarded to me, and then that's the very first question. So I think, I think Kaylee, no, not Kaylee, somebody, the very first one who asked that question. So the N95 is basically a type of mask that is recommended for healthcare workers, and pretty much is really reserved for that. You can still wear it even if you're not a healthcare worker, but remember, if you're going to be in a high-risk situation, just like a healthcare worker working with patients, I think they're more at risk of getting COVID. That's why that's recommended for them. But having said that, you're allowed to wear it, but it's not recommended for everyone, because we want to make sure that it's used appropriately. And the N95 is the type of mask that is regulated, meaning to say there's a qualification or certification that it can filter out airborne pathogens 95% with the measurement of about 0.3 microns. So that means to say that is certifiable, that it can really prevent, it will not penetrate that 95% of the time. Now, there was a question about KN95. So the K, that's from China regulating that certification. So pretty much they're kind of the same concept, but it was just from China. And what we learned is that many of those KN95, they have varying effectiveness in preventing, those, whatever they say that it's 95% effective in preventing or penetrating the mask. 60 to 70%, they found that what's labeled KN95 are actually not KN95 at all. So there's some quality issues with that. And CDC has kind of put that statement on that. With regards to general masking, it's believed that 70 to 80% of the time with the regular mask, face cloth covering all this, mouth and nose, will prevent transmission to another individual. And the type of mask you have is the one you can buy. Is like for the surgical one, there's a waterproof on the outside and the inside. It also protects the wearer, and it also protects the one in front of you as you breathe through that. And so, but it's not only unique to that. You can wear a face or cloth mask, and CDC has already kind of, and I'll show you in the slide, the things or qualities of the mask that you can wear that's effective in preventing the spread of the infection. And you can do double masking for high-risk situations. And it has, there's data to suggest that it's better than a single mask. So that's why the recommendation is at least 2 layers of fabric in the mask that you're gonna have to wear in order to have at least an effective prevention of transmission.
Okay, thank you. And also just quickly on testing, what is your recommendation?
Yeah, so and there's a question there with regards to rapid testing and all this. So there are different platforms. I mean, I remember looking at the data, when learning about this testing, it's about more than 144, probably now it's more than 200 laboratory platforms that are authorized by emergency, meaning to say they allowed this laboratory to develop their own tests to be used. So there's a lot of confusion, a lot of testing, validation on their own, and then they come up with all these numbers, right? So it really took time before those regulators kind of settle which are the best, which are not enough, quite enough to kind of to be useful. And what we know is that PCR testing is more sensitive than antigen testing. So, and there's a purpose for each of that. And of course, if you really want to make sure that you got the right diagnosis, you want to use a more sensitive test, and that is the PCR testing, right? If you just, want to, for example, low risk situation, the antigen testing using serial antigen testing, maybe you can use that, but it may still not be as sensitive as PCR testing. And there are some pros and cons to that, because PCR testing, which can be done as a rapid platform or laboratory testing, they have their own validation as well in terms of sensitivity and specificity. But most of the time, they're very specific to the SARS-CoV-2. It's more of the sensitivity that differs from one platform to another.
Okay, so much to distill, and there's probably still so many questions out there, but this has been a very, very useful 60 minutes, I would say, for me personally, and I hope for all of those who have joined us. And I just want to thank both of you for taking the time and sharing your reflections. And I think that each of you have provided also hope. And I think by working together and taking care of ourselves and each other, and just basically practicing exactly what we were told from the beginning, wear your mask, social distance, wash your hands, get vaccinated, and stay informed, and go to, hopefully the trusted and accurate source of information that you've chosen. And I know Baystate Health will have, updating their website daily. Public Health Institute, we're updating our information, as I'm sure Mercy and other healthcare institutions in the region. So I want to say thank you so much, Ms. Doris, Dr. Paez, and everyone who helped put this on. And I wish all of you a safe and happy week and Labor Day weekend.
Thank you very much.
Thank you.
Thank you.
And if you can, just please fill out our survey. I'll put it in the chat as well, so that to let us know what you think about the work that we're doing. Oops.
And also, if I might suggest, I know there's a lot of people who ask questions and that we haven't covered. I'm happy to answer those via email if just to kind of, I know they're probably signed up and waiting for their questions to be answered, but
Yes.
I'll take time to
thank
answer
you.
those questions. Yeah.
Thank you so much. We typically will copy the questions in the chat that we didn't get to, and then we take all of the questions and we actually will put an answer. So we would love to reach out to you. Actually, you can help us answer them, and then we'll put them on our website.
Yeah, and of course, if there are questions that have already been answered, you just kind of choose the ones that we haven't really covered. I just want to give a chance for everyone. I know this is a very short topic, and COVID-19 has been with us for more than a year, so I'm sure there are a lot of questions, a lot of scenarios to run through. So
Yes.
I may not have all the answers, but I can tell you what I think and the certainty of evidence. So
Great. Thank you so much to both of you. I know our audience is slowly leaving us, and we will follow up with you to get all the questions answered and any feedback that we get from the webinar.
Yeah, I'd like to thank Doris as well. I learned something what you said about how to talk to my patients, for example, in France.
Thank you.
Thank you.
Thank you very much. Have a good afternoon.
Bye now.
Bye-bye.